Hello, my name is Scott Boyken, a physician here at Complete Health. I want to talk to you about the various complications and treatments of diabetes. You may be experiencing any number of these complications, but we will help you to understand what to look for and how to treat them so that you can have the best quality of life possible. Here are the top 6 areas we will be looking at: circulatory complications, kidney disease, vision problems, the nervous system, skin and wounds, and the brain. The circulatory system includes your heart and blood vessels. Patients with diabetes are up to 5 times more likely to have heart disease, including heart attacks and strokes. This risk is even greater if you smoke. Not only are people with diabetes at increased risk of heart disease and stroke, but also peripheral vascular disease. Peripheral vascular disease is a blockage of vessels that supply blood to your arms and your legs. This is the reason why many people with diabetes have trouble with healing wounds, which typically leads to amputation. Patients with diabetes are at greater risk of suffering from kidney disease. Diabetes is one of the most common causes of chronic kidney disease because of the natural course of kidney function with diabetes is to decrease over time. The eyes can also have trouble with diabetes. Diabetes is one of the most common causes of blindness due to the problems with the blood vessels in the back of the eyes. Patients with diabetes can also suffer injury to the nervous system over time. This leads to problems within the GI tract, preventing food from moving through the intestines correctly. This commonly leads to diabetic neuropathy, which is a numbness and tingling in the hands and the feet. Many patients with diabetes unknowingly suffer injury to their feet because they couldn't feel it. Patients with diabetes have skin issues and wounds that won't heal due to the poor circulation and nerve issues described previously. Poor circulation makes it difficult for wounds to heal, which unfortunately often leads to the amputation of fingers, toes, and limbs. There is evidence that over time, high blood sugar can cause changes and sometimes damage to the brain. This puts patients at higher risk of dementia and depression. The good news is that by working together, you, your doctor, and your care team can monitor and hopefully prevent many of these complications. In general, we recommend weight loss through exercise and diet, compliance with medication, and to stop smoking. In most patients, following this simple plan can prevent almost all future complications. Additionally, there are more specific treatments that have been proven quite effective. In the case of heart disease and stroke, your care team will routinely monitor your cholesterol, aiming for very tight control compared to those without diabetes. Patients with diabetes that can tolerate medications for cholesterol are encouraged to take them in order to prevent side effects. Depending on your individual case and symptoms, testing to evaluate for cardiac and vascular disease may be ordered. Many classes of diabetes medications, including GLP-1s and SGLT2s, like Trulicity, Ozempic, Jardiance, and Farxiga, have shown to prevent or slow the progression of heart disease. To slow and prevent the progression of kidney disease, we routinely perform tests to monitor the changes of kidney function early. If we start to see changes in your kidney function, we have blood pressure medications like lisinopril and losartan to slow the progression of the disease. Some of our new meds like Jardiance and Farxiga may be helpful as well. To prevent eye complications, you should get eye exams every year. These can be performed by your eye doctor or in a complete health clinic and can catch changes quickly to prevent long-term consequences. To prevent nerve and skin issues, we recommend that you inspect your feet daily for any signs of problems. Your care team will perform an annual diabetic foot exam in the clinic to look for neuropathy and provide education on routine foot care. Special shoes can also be used to prevent friction that might lead to ulcers and non-healing wounds. There are many complications from diabetes, which can be scary, but if we work together, monitor your treatment, and communicate, we can catch issues early and treat them appropriately. Visit us online at completehealth.com/diabetes to find more educational materials and to contact your care team.